Back in Canada, Ontario's reporting more than 100 COVID-19 cases for the fourth day in a row. The province confirmed 105 new COVID-19 cases today. That number down from the 115 cases reported on Saturday and 108 cases on Friday. Ontario's health minister said that 30 of Ontario's 43 public health units are reporting 5 or fewer cases of COVID-19. For more, I want to bring in infectious disease researcher and Canada Research Chair at the University of Calgary, Dr. Jenne, joining me now from Calgary. Hi, Doctor.
Hello.
So today, Ontario reporting just a little bit more than 100 new cases of COVID-19 for the fourth day in a row. That is a decrease from the numbers reported on Saturday and Friday, but still over 100. So what do you make of this trend? Should we be concerned?
Well, I think what we need to be watching for is which direction does this trend continue in. So if it's going to plateau around 100 cases, and that's what we've seen in Alberta, there was an initial uptick and then it plateaued for a period of time. If you can hold the number of cases at a steady state, it means it's not expanding much in the population. So that's a good thing. If this is really an early warning to a steady increase over the next several weeks, then it's time to probably take some action. So unfortunately, single day numbers really not that informative. We need to be looking at the trend over a period of weeks.
Right. And what's interesting to me is the majority of these new cases that were reported today are between the ages of 20 and 50. So what can we glean from that?
Yeah, again, this is following the trend we've seen across the nation. It likely reflects that people are picking up cases more in their social activities. So people, for example, that are going out to dinner or going out to bars or meeting in large social gatherings, as opposed to just essential services. So earlier in the pandemic, we saw that the infections were more likely linked to, for example, long-term care facilities or people needing to be out for essential activities. Since we've opened up the economy, opened up restaurants again, bars, and some social settings, we've seen the shift in cases to the people that are going out and meeting in larger groups or attending indoor events.
Right. And so with back to school just around the corner, are these numbers concerning? We're seeing an uptick in Manitoba as well.
Yeah. So again, it's going to depend on if we can hold the numbers here. If it's a growing trend, then that is definitely a problem. We do want to keep the numbers as low as possible in the community. Even a steady state at a relatively low number still means there's virus in the community, and bad things happen when that virus can be, for example, introduced into a school. So the lower we get the numbers in the community, the less likely an infected person, for example, enters a school or a workplace. Right now, it's still the key is to ensure that that trend is not growing and that instead it is stabilized. And from there, we can proceed with schools relatively safely.
Sure. I want to ask you, if I may, about this plasma therapy that we're being touted. It's been approved by the FDA, but the World Health Organization says it's not, well, I want to get the correct words, but they say it's not a definite proven treatment. What's your take on it?
So this is honestly one of the therapies that we're most excited about from most immunological points of view, that this is, the next logical step and a therapy that makes sense. Unfortunately, we may be seeing a little bit of politics involved here. So this therapy, although currently being studied and it's looking good, we don't have the efficacy data yet to say that if you receive the therapy, you do better than somebody who doesn't receive the therapy. So what we're learning is it doesn't seem to hurt you, but we don't know if it's actually helping in the way that it's being reported. And that's because we've cut the studies a little bit short. We're always worried when this happens because the question gets to the point, will we ever get the real data? Will we, or have we circumvented the approval process? And it's not good when politics mixes in. But the good news is we will continue to get data on this therapy, and it is, at this point, looking promising. Maybe not ready yet, but definitely looking like a good option.
Dr. Jenne is an infectious disease researcher and Canada Research Chair at the University of Calgary. Always good to have you on, Doctor. Thank you.
You're welcome. Take care.
You too.